I get the pleasure to introduce this, and so we've been working on these NCSCT resources with many colleagues, and it's been really, I think, quite a remarkable journey. I think back to working on the British Thoracic Society tobacco dependency audits of hospitalizations, and the BTS ran these audits in 2016, 2019, and 2021. And over those 3 audits, really sobering and really depressing, I guess, results of the lack of standardized implementation of tobacco dependency services, and using those audits to really try and create a spotlight on that. And then since then, we've had 3 years of long-term plan funding, and it feels to be a seismic shift that has happened in those few years to having tobacco dependency services across acute care trusts. And it is very much now becoming a new standard of care. And I think we've had that demonstrable shift. And this feels like another important moment, because we've got some really important frameworks that have just been published, both from the BTS and also these from the NCSCT. It's an exciting time that we've got a new medication coming into the tobacco dependency field. So it feels like a real opportune moment to grasp this and to go even to the next level of what's been achieved over the last 3 years. So next slide, please. And this is our promise, and this has been the goal behind everything, which is treating tobacco dependency with the same clinical priority that you would with any other life-threatening condition, of which this absolutely is. And I think it's been really important about how the language and the concept of this has really changed into diagnosing a condition, initiating treatment, providing behavioural change support and onward support at the time of a hospital admission. And that's been very different from smoking being considered a lifestyle choice recorded in a social history. There's been a real paradigm shift in the language used. And this is our shared promise that will never happen again. And that tobacco dependency will now always be recognised for the very powerful addiction that it is, and the chronic relapsing disease that it is, that has very effective treatments and can be managed as such. The next slide, please. And I just really wanted to draw attention to, in amongst all of the documents produced by the NCSCT, is this key messages and changing our language document, which I think is a really important document, and really helps to crystallize some of those concepts of we're no longer seeking people motivated to quit smoking, or those that want to quit smoking. We have people coming into hospital settings that are smoke-free environments, that have a very powerful dependency, that have medical managements to prevent and alleviate. And the delivery of smoke-free admissions has immediate and substantial benefits that are not just linked to long-term abstinence. I think it's a really, this is at the heart of all of these documents, and I would very much recommend having a look through them. The next slide, please. So it gives me great pleasure to introduce a number of my colleagues, including Melanie Perry, Sophia Papadakis, and Mary Yates, who will take us through the various different aspects of these NCSCT documents. So Mel, I think you're up first.
Thanks, Matt. Really pleased to be here. Just framing the setting now for my set of slides, kind of following on from Matt's sort of the way that he's been presenting it is to really identify treating tobacco dependence now as a clinical priority, as the single most important preventative intervention we can provide for patients who smoke. And I guess it's just reminding ourselves of this, really, that we have this life-saving intervention for what is a treatable disease. And it's really important to remember that we prioritise this and standardise the treatment that is provided for this intervention throughout all acute settings. And when I say about the settings, I mean mental health, I mean maternity, and I mean acute inpatients as well. And this is about providing high quality interventions. So we have this standard treatment plan that has been designed to aid all people who work in these trusts, in these settings, to provide a clinical tool to support the delivery of an inpatient tobacco dependence treatment pathway programme. Standard treatment plans aren't new to the NCSCT. We have them for other work streams that we provide stop smoking support for, but we decided to put together a bespoke, specific guide for this very different approach to supporting people for their tobacco dependence, unlike the way that it's treated in the community. There's also there's a new one being launched very soon for mental health. So we have the inpatient one currently that's been launched, and it's available on the NCSCT website now. And we have the mental health one that's coming very soon. And this is full of evidence-based guidance. There's TDA tips in there, there's checklists, and this walks you through the new way of treating patients in hospitals using the treatment care bundles, which I'm going to introduce to you now. This is thanks to Matt, actually. I'm going to credit Matt for this. This was Matt's idea, was to use something that is not unfamiliar in a hospital setting by using care bundles. You might be familiar with them. People use them for different care pathways to treat other chronic disease conditions during a patient's journey in their hospital. So it's kind of a collection of interventions that can be applied to the management of a particular condition. They're devised using evidence-based interventions to improve the quality of the treatment that patient is going to receive during their admission, through to their stay and on discharge. And it really makes sure that all of the tasks and the necessary treatments are all undertaken during a specific time and place throughout their kind of mapping the patient's journey as they transition through their treatment during their stay. Next one, please, Sophia. So these are the 3 care bundles that we put together. We've got the admission care bundle, and the responsible team for that is the admitting team. We've got the inpatient care bundle, and that's the specialist assessment and treatment plan that is responsible for the tobacco dependence treatment team to undertake. And then we have the post-discharge care bundle, ensuring that we don't just discharge the patient and then forget about them and they go home without any sort of ongoing support. So they're the 3 treatment care bundles, really nice, simple, clear, easy to follow. And I'm going to break those down for you now so that I can just talk you through each one in a very sort of overview type way. So when we look at the admission care bundle, I've already explained that we have the admitting team that are responsible for this. So this is the frontline staff. These are the staff that are responsible for looking after the patient within their first couple of hours of admission. And this is a really key, they have a really key role to play in this, because when a patient's admitted to hospital with a tobacco dependency, it's most probably that they'll be suffering sort of the effects of nicotine withdrawal already when they come in. They may have been admitted through ED, they may have spent some time in triage, so they'll already be feeling uncomfortable and want those nicotine withdrawal symptoms managing. So it's really important that they act quickly on this. I think the next slide kind of goes through the steps. So we've broken each bundle down into 5 clear steps to make it easy to learn, easy to walk through. Like I said, the admission care team are responsible for going through this. So it's just around identifying the fact that the patient smokes, providing some brief advice on the importance of like not smoking whilst they're in, and then talking to them about the treatment that they can have. So initiating that treatment as promptly and quickly as they can to manage the urges to smoke. Then let the patient know that they will be referred to the inpatient specialist tobacco dependence team, using whatever pathway they use to refer. And then recording this is really important. Tobacco use in the past was recorded in all sorts of places, usually in the wrong places. So the fact that we now recognise it as a chronic relapsing condition and which needs medical management, then it's really important that it's included in the admission diagnosis list and the disease management plan. Next slide, please, Sophia. So then we move on to the patient's initial assessment. Now, the responsible team here are the tobacco dependence team. And ideally, this would be carried out within the first 24 hours of the patient's stay. So this is where the TDAs and their specialist skills can really come into play. So they will sort of meet and greet the patient, introduce themselves, check how they're going with their management of their urges to smoke and the withdrawal symptoms, make sure that maybe tweak their NRT or whatever prescription prescribed medication they'll be taking, do an assessment on that, work on those behavioural support techniques, and then agree with the patient on the treatment plan during their stay. And also starting to think about how they're going to be managed once they're discharged, and going over that and revisiting that as many times as they're able to during the length of stay for the patient. It's really important that the discharge plan is already kicked off kind of on the early days, so the patient doesn't feel like it's just going to drop off at the end. Okay, Sophia, next one, please. So this is the final care bundle. This is the post-discharge, and it's really important. This is where the relapse prevention comes into play. Because an admission to hospital is a really teachable moment for a patient, and to really utilise that opportunity when they come in, when they're worried about their health, they have concerns about the management of other conditions, that stopping smoking is often easy to do whilst they're in, especially if they're being supported by the tobacco dependence team and they've got medication and they're not worrying about needing to smoke. However, once they're discharged, this is when it really steps up. And that transfer of care out into the community throughout to wherever it's the community stop smoking service, the pharmacy, using a digital aid. It's really important that that is followed up and discussed with the patient, and that medication is provided to be able to continue with that. And it's always important to just keep providing like a summary, keeping the patient informed, as well as the treating team for the patient's other conditions that they're in for. And this is working through these care bundles. So in the standard treatment program, under each care bundle, we've provided the checklist. We've also done like some little tips underneath. There's a more comprehensive version in the standard treatment program where there's suggestions of script, because I think often it's really hard to know how to put into words some of these methods. And so it's really important that that script is there to help you come up with maybe some of the phrases or the ways in which you could use your skills to be able to communicate, along with some tips as well. So there's a nice checklist there you can print out, laminate, and use for your working through your care bundles. Next one, Sophia. We've also provided some quick reference tools. These are really useful for new starters. I think in my days when I was working in an acute setting, I'd have found these really useful to use for teaching aids for healthcare professionals also, who are often unsure of the right products or medications that they should be using, or would just like a little bit more information about them. So these are really good quick reference tools that are available as well on the website. Finally, this is a slide I put together many years ago, before we had the key messages, before we had the new terminology, and it's around changing the stigma and the attitudes and the culture around treating tobacco dependence in an acute setting. I think for too long now, like Matt said, the landscape has changed a lot and shifted, and it could never be a better time for us to utilize our position, the profile of treating tobacco dependence in a more positively framed way. So it's to use the right attitudes along the lines of medical management, that this is a clinical condition and it's every clinician's responsibility to treat tobacco dependence. I think that's me done. Thank you.
Great. Having heard from Matt about the why and the very important clinical importance of this issue, and from Melanie on the what, the standard treatment plan, and sort of the standardization of a high quality intervention from all members of the clinical team, from admission through to the tobacco dependence team, from hospital into community. I'm going to take the next few moments and just ensure we familiarize you with the training resources that are there to support the implementation of the new care bundles, and ensure the workforce that are supporting these have all of the training they need. And we know in working in tobacco, there is the clinical side, how to use the medications most efficaciously, a little bit around management of withdrawal, and even more important is how we have these conversations with patients who, for example, may have entered hospital without any intention of discussing smoking with anyone. So how do we apply our best known evidence-based practice around counseling and discussions and conversations? That's what the training is about. And I'll just walk through that. I wanted to acknowledge as well that we've had a webinar to launch these materials a few weeks ago, and we'll go in a little bit more depth than we provided in that sort of launch webinar. So to introduce the training suite, on the screen here is the acute inpatient materials. We heard about the key messages. Matt mentioned that. Melanie just talked about the standard treatment plan to the left of the screen. And the training suite, I will walk you through in a few moments, for TDAs has been developed. And that's to ensure all of the core competencies are mapped onto a training curricula to make sure our TDA workforce is prepared to deliver the standard treatment plans and are comfortable and confident in their roles as TDAs. Coming very soon is a new e-learning, and this e-learning is directed to frontline staff and the admission team primarily. May I say, though, that components of this e-learning are very appropriate for all staff, including TDA and other clinical groups. So that's forthcoming. The equivalent, if you will, the sister training suite is also in development and will be launching in the next couple of weeks for mental health hospitals. And it's been delayed slightly because we thought we were doing a sister suite. And as it turns out, we are doing a full tailoring to make sure the standard treatment plan, the training materials already launched, and the e-learning forthcoming are absolutely tailored to the very unique circumstance of a longer admission in a mental health setting, and some of the nuances, the very important nuances that come with effective treatment in that setting. This is all about a trust-wide approach to training, today's webinar, and we are very strong believers, all of us who have been working in this area for many years, and I'm sure you are as well, of the importance of us all moving as an organization, and to do so that we all need a common basis of looking at tobacco, training on the latest evidence-based practice, and that includes leadership. And I know many of you on the call today are leaders of your service, of your ICS or your region. For the staff, meaning the frontline staff from nursing, pharmacy, allied healthcare professionals, and our physician colleagues, and everyone else in the organization, we all need to understand this is a treatable clinical disease, and then how do we treat, and what is my role in that? And for the newly introduced over the last several years tobacco dependence team, to ensure that we were giving high quality service delivery, and that includes leads right through to the specialist team and to all TDAs. So with the understanding that a trust pride approach to training is so important, what we've tried to do is develop resources for each of these very important priority groups within a trust. And on the screen, you will see a training matrix, and it really is here to help identify for frontline staff, for clinical staff, in particular prescribers of first-line tobacco treatment medications, and for our TDAs, what training resources have been are available for use and to support these various healthcare professionals and organizations. So this is the training matrix. I thought what I'd do is take a few minutes rather than dwell on this slide and walk you through for each audience what is available. And that'll start with the tobacco dependence advisors. We have introduced a training suite. I think it's fair to say a comprehensive, state-of-the-art, best-in-class training suite to be delivered either through a 2-day course, virtual or face-to-face. Our mantra was flexible training and flexible approaches to training, or module delivery, meaning that at the level of the trust, you look at your local training needs for your staff group, depending on the level of experience that you may have, that you use this training suite, which includes 21 individual modules or a 2-day course, to design your own course based on your needs and delivered as you see fit. Might that be every Wednesday or half-day education day? The training suite is to support all of the local teams with doing that. And what you'll find in there are a variety of resources, but really specifically course outlines, trainer's guide. So for the individual who will be leading training locally, it walks you through exactly how to run a mini training session or a 2-day course, PowerPoint slides to deliver the training, presenters notes for all of the training content. So for each PowerPoint slide, what is the teaching point? What is the learning point, and how do I deliver that? So it's really like a mini class, if you will, in training delivery. Case studies are found throughout the course. These are very important case studies. They've been designed to provide practical application of all the important behavior change techniques, the use of medications in a variety of clinical scenarios that you'll be seeing, that we all see in our real world work. There are skills and activities and practice sessions to make sure some of the teaching is applied to practice. Film clips are found in there, and the film clips come from Greater Manchester, from the NCSCT, from FRESH, and I want to acknowledge all of those teams that have done such a great job of producing, if you will, tangible training resources. They've allowed us to adopt them into the national course, and so you'll find them at different points of the training program. And of course, handouts and reference materials, and even course evaluation if you want to keep track of how well received the courses are locally. On screen are just screenshots. I won't dwell on them, on the quality of the training materials that you'll be able to access for local delivery. And to acknowledge that annually this training course will be updated, all of the materials, and we'll be looking to make sure it always reflects the latest evidence-based practice. So that translation of latest evidence into the training course is part of our work plan going forward. Here are some of the case studies which look at patients who are ready to stop smoking because of their clinical situation, those that are ambivalent, those that absolutely don't want to engage, and those that are in serious withdrawal, and how we manage each of these scenarios is looked at from the point of admission through to their stay and treatment from the tobacco dependence team. And we walk them through during the training materials and the case studies into their follow-up period post-discharge from hospital. The equivalent are there for mental health, and some of the more difficult situations that are encountered there are tackled directly in the training course. And we provided a recommended national TDA training standard. It's recommended, but it involves the e-learning, the 2-day induction course, the CPD that would be delivered as you feel appropriate, but perhaps using some of the training resources. And just to emphasize the importance of on-the-ground training, so shadowing an experienced advisor, observation of their own clinical practice of a new TDA, and mentorship. So the continuous quality improvement and building of skill set of our TDA workforce. So having looked at the TDA treatment package, and maybe I just should emphasize for a moment, inside that treatment package, the 21 modules that are available, should you want to see each one as someone who's designing local training, there is a 1-page document that walks you through what each of the 21 modules are, what are the learning objectives of each, and how do I access them? And you download them from the NCST website. So for frontline staff, we'll be quicker here. There is an e-learning that will be launching in a few weeks. There is the training pack, the same modules that we talked about, the 21, to be able to pick and choose to deliver, if you will, in services on the ward floors, short education opportunities that are planned across the organizations or particular groups. That includes clinical teams, pharmacy, or the admission team. And many groups have chosen to do a 2.5-hour advanced course, if you will, a longer duration, really to build the skill set of particular groups, in particular the admission team and the pharmacy team, who are working in a more advanced area on tobacco treatment. This is the soon-to-come e-learning, and to mention that it has 4 modules in total. Just to give you a sense for that, the first is tobacco dependence treatment in the inpatient acute mental health setting, an introduction, if you will, to that and to the admission care bundle. It's a good walkthrough. It includes lots of film clips about why we do this, to really capture the hearts and minds of our clinical staff and the admission team about why it's important to do this. And then it walks through the admission care bundle and the very important elements of that. A dedicated module to inpatient mental health, to tobacco-dependent aids, to getting to know those with videos on how products are used and what's the latest, as well as a module on carbon monoxide testing for trusts that are using that as part of their pathway. I'm going to play very quickly just a 2-minute film clip from the e-learning so that you get an introduction. And this particular film clip is one of many in the course, and it's on the admission care bundle.
The Tobacco Dependence Treatment Admission Care Bundle focuses on brief advice and acute management of nicotine withdrawal. It includes the following steps. Identify the patient's smoking status. All patients who report smoking in the last 14 days are eligible for treatment. Advise the patient that this is a smoke-free hospital, and it is standard practice at our trust to provide support to help them stay smoke-free and manage their withdrawal symptoms and urges to smoke. Advise on the importance of smoke-free admission to their recovery and improve treatment outcomes. Treat. Initiate combination NRT, such as a nicotine patch, plus a faster-acting NRT product as soon as possible at the time of admission. It is ideally within 2 hours for acute inpatient settings and 30 minutes in inpatient mental health settings. It is important to provide patients with instruction on the correct use of NRT. As appropriate, consider the use of nicotine vapes and nicotine analog medications. Refer. Inform patients that they will be referred to the on-site tobacco dependence team for assessment and further support and/or treatment, and arrange referral through the local pathway. All patients should be treated and referred regardless of their interest in stopping smoking, as part of the standard care for tobacco dependence treatment. Record tobacco dependence in both the admission diagnosis list and the disease management plan. All patients should have a medication review for medications that interact with smoking. As required, consult with the patient's prescriber regarding the need to adjust the dose of some medications, like clozapine, and arrange blood monitoring. The tobacco dependence treatment admission.
Give me what to replay. So we just wanted to share that with you. I see in the chat there are some questions around cost. This is an open access training resource published by NHSE with their commissioning, co-produced with NCSCT and a team of national experts that we'll acknowledge in a few moments. And it is free of cost to access from the website. You simply go on and download like we would other materials from the NCST website. So there is no cost. I will mention, if in-house you prefer to commission a course externally, the option to do so is available. And that would be via NCSCT or via any training group, because there are a number of training groups across the country that for many years have been providing local stop smoking services training. And so this really is our new national training resource that we hope a variety of teams locally and nationally, and depending on what's available, will use and access as a standard way that we can support all trust staff in their work. So hopefully that's helpful in answering that question around cost. So I'm going to turn over and I'm just going to check to see if my colleague Mary Yates is with us to say a few words. And can I check with the team at ASH, because I don't see Mary online and I wonder if she's had some technical difficulty, and we'll move on if that is the case.
I'm here, Sophia.
Oh, there you are.
Yeah.
Thank you. Thank you, Mary. Sorry.
Thank you very much indeed. Hello, everyone. Good afternoon. My name is Mary Yates. I'm a member of the group that have worked to put together the resources. So thank you, Sophia, for the introduction, and to Mass and Melanie again. Thank you for taking us through all these wonderful new resources. So next slide, please. Now, The scale of the problem that we are facing in mental health services, those of you on the call who work in these services will know, is huge. We see about 20 to 30% of smokers coming into acute hospitals as current smokers. I'm afraid to say it's about 70 to 80% of patients coming into mental health hospitals that are smokers. So we've got a lot of work to do. And in establishing a new smoke-free culture and establishing this new attitude to recognizing tobacco dependence as a disease, as we've heard from Matt and Melanie, and embedding all of these new training resources must come, I think, alongside lots of other changes. So support for new policies and procedures, new treatment pathways, new infrastructure, and of course, new data sets that can help us to review and evaluate what we're doing. I think what must be at the heart of achieving our new culture in mental health services in particular is making sure that we've got our service users and patients at the heart of making these changes, so that they are helping us to develop a competent workforce. Next slide, please. So we've seen very much in great detail about the new care bundles, and the care bundles apply across the NHS and apply equally in mental health services as well as acute services. I'm very interested in us starting by looking at how we can adapt these training resources and materials for our patients and our service users in mental health care. What we need really is to translate some of these new materials into accessible information for our patients, and to think about how we can get our patients involved in co-delivering some of the training locally, so that we can really shift the culture. I think that when we embed real-world patient stories into our training, it really brings it to life and it has high impact. And I think also Sophia has told us about the different layers of training, that we need those layers of training for our TDA workforce that are close to the patient, but also for those staff that are in the wider mental health care team, making sure they're able to, at the point of admission, deliver the effective point of care treatment care bundle, but also embedded throughout the whole patient stay. We can see from the new NCSCT e-learning course, and that clip gave you a very good insight into it, that there will be a great deal of clarity, hopefully, about what the point of care team are expected to do. But I want to draw your attention also to the new NCSCT course for community mental health workforce, which is also available now on the NCSCT website. To date, 160 staff have completed that training, which is wonderful, but that's just a tiny drop in the ocean. We really want to see that number grow, so please have a look for that as well. It's very important that staff working in community mental health services are preparing people for admission to a smoke-free environment, so that it isn't a big shock when they arrive, but also helping people at the point of discharge from a smoke-free hospital to be able to maintain and then build on their successes. Next slide, please, Sophia. So what we're trying to achieve in mental health services is a real change, and Melanie talked a bit about that, the change in the hearts and minds, a change in the language. And it isn't good enough really for us to just tell people what to do. We've also got to really be very good at explaining why we're asking people to do this, have this new approach to treating tobacco dependence, and how we can make sure that people no longer see smoking as a lifestyle choice or a bad habit or a personal freedom. So that really requires quite a bit of effort. I once helped a woman to stop smoking when she was admitted to a mental health ward. And about a week after her discharge, I followed her up and found that she had returned to smoking again. And when I talked to her about what had happened, she told me that at the point of discharge, the doctors hadn't prescribed her any more NRT. And in fact, the nurses had returned her cigarettes to her, the ones that they had confiscated from her at the point of admission. This became a really valuable learning exercise for us because we were able to really explore the assumptions the doctors had made. They had incorrectly thought that the patient was only using NRT because she was detained in hospital and not because she really wanted to. And the nurses had made the assumption that they would get into trouble if they had destroyed the confiscated tobacco materials. So bringing those real life stories into class, into our training and education settings can really help to ensure that we are able to change the hearts and the minds and the culture in our mental health organizations and help us to get to a place where everybody has this new standard of practice, which is what Matt talked about at the beginning. So on to the next slide, please. And I think what we really also want to try and work towards across all of our NHS services, both acute and mental health, is to have a high level of motivation now in these new practices. And we can do this by having protected time for training, making sure that we are creating safe environments for the training, and helping people to have autonomy and belonging and control over that training, because it can really make a difference when people feel they belong to a group of learners and it's a safe place to practice these new skills. It can be really quite difficult to know how to start the conversation with somebody about their smoking. And so it's going to take us time to move from being novices at doing this to being experts. And so my final slide is, I was reflecting on my experience over 38 years of working in the NHS. I did my basic life support training every year. I was delighted to do it. And thankfully, I've never, ever needed to use it, either in my workplace or outside of the workplace. And I wondered what my life and what my work would have been like if I'd been able to do tobacco dependence treatment training every single year in the same way, because every day in my working life, I encountered multiple opportunities to save people's lives by providing tobacco dependence treatment. So I suppose my ambition for the future is that we will start to see tobacco dependence treatment training in the same way as we see basic life support training, something that all of us must do at least once a year and much more often if we can. So thank you very much. I look forward to meeting those of you from the mental health workforce in our breakout room. I think my final task is to thank all the experts, and there have been a lot of them. These are the giants in the field, the people who put together the acute resources, wonderful people, and my colleagues in the mental health group. You're just amazing. Thank you all so much.